Welcome back to our Feed the Soul Summit this morning. I am Miriam Glass, the founder of Athlete Soul and your host for the event, as well as plenty of panelists with us to talk about this next session. So we are back from this first session where we talked about athlete wellness. Now we're focused on emotional health, athlete emotional health. And so we're going to have 3 panel discussion back to back. The first one with you guys when we're talking about how do we encourage athletes to ask and seek emotional help? A super, super important topic at the moment, after the games, after the summer, after we've seen lots of athletes open up about their mental health. So we want to continue to encourage people to seek help as they need it. And we have an incredible panel to discuss that with. Quick note, we are recording the event. It will be available to all our registered participants after the event. I will be sharing it on our website as well and on our social media channels. And we're not taking questions because we are going pretty quickly with all these discussions, but you will be able to submit questions after the event. We will have an online forum discussion. So I'll follow up with some information on that. But for now, I am going to get started right in. So I'll get each one of you to introduce yourself and then we'll kick into the discussion. So Eric, you're the first one on my screen. Can I start with you?
Guinea pig, sure. Hi everyone, my name is Eric Kussin. I'm the founder of an organization called the hashtag Same Here Global Mental Health Movement. I've worked in professional sports for 15 years on the team side and the league side with the NBA. Went through my own mental health crash. Went through a very allopathic route of healing that did not lead towards healing. Ended up reframing the way in which I see mental health as a conversation. Was fortunate enough to be able to partner with, at least in this case, athletes, but also people with platforms outside of the athletic world to start to normalize a conversation around the stories related to the challenges that we face instead of the disorders that we have. I don't think there's a person on this planet who hasn't faced challenges that have impacted their mental health. Makes the conversation for 5 and 5 instead of for what we always hear about 1 and 5. And look forward to having this conversation today.
Thanks, Eric. Shannon, do you want to go next?
Sure. Hi, everyone. I'm Shannon Decker. I'm the executive director and co-founder of a nonprofit called the Speedy Foundation. It is 10 years old. It was founded in memory of my cousin, Jarrett Speedy Peterson, who's a 3-time Olympian on the United States ski team. And tragically, 10 years ago, he died by suicide. He'd spent some time in his professional career talking about challenges and traumatic experiences in childhood and really advocating for others. And so when he passed, there was a lot of frustration because we knew that he struggled and there wasn't a clear path to help. And so our nonprofit in the past 10 years has really worked on advocacy, education, and conversations. And we're really excited to see that, especially in sports, mental health has really become a conversation that is available to talk about. 10 years ago, it was a very, very different situation. And, at this point, the Olympics, are addressing it. The US ski team is starting to address it and provide resources. So that's my little area.
Super. Thank you, Shannon. We're excited to have you here. Cami?
Hello and good morning. My name is Cami Craig. I am the former center of the women's U.S. water polo team and had the honor of competing and representing the U.S. team at the 2008, 12, and 16 Olympic Games. Recipient of 2 gold medals and a silver medal. I love to lift up the silver medal as it was a big part of receiving the 2 golds. And I'm now working with youth athletes on mental skill set coaching, performing, and executive coaching as well. And I'm excited to be here and give the athlete perspective.
Thank you, Cami. Jessica?
Hello, everyone. I'm Dr. Jess Bartley. I am the Director of Mental Health at the USOPC. I just celebrated my 1-year anniversary. And then I'm also a Clinical Associate Professor at the University of Denver. So in my role at the USOPC, I was tasked with really creating some very specific programming around mental health for our Olympic and Paralympic athletes, and then also supporting our various sports on how to support their pipelines. And so we created an external mental health task force a couple of years ago, and I'll give a shout out to Shannon, who's a part of it, who has been able to help us direct some pieces around what athletes are needing around their mental health. And so we have experts in the field as well as coaches and athletes on that external mental health task force. And then we have been able to hire out a team as well at the USOPC. So we currently have 5 full-time mental health providers, and we'll be hiring an additional 3 in January.
Nice, thanks. Thank you so much. Kelsey, you're up next.
Hi, I'm Kelsey Rupang. I am a licensed clinical professional counselor and group practice owner in the Chicagoland area. I specialize in sport and health psychology, and I work primarily with chronic pain, chronic illness, and sport injury. I played sports all my life and had my own multiple serious sport injuries that led me to exit from sports. So that's kind of why that became my big specialty. And we're also working on some research out of UIC here on female ACL tears, identity, and emotional recovery.
Thank you, Kelsey. What a panel and a great perspective and angles we're going to be able to use from here. So just real briefly about myself, I'm also an Olympian like Cami. I'm a 2-time Olympian in the sport of synchronized swimming. And I'm really excited to be talking about this topic today because as an athlete myself, I certainly had my up and down during my career, and I definitely did not seek help. So I really want to start diving in because we don't have that much time. I want to dive into this topic and ask you this first question. Why is it so hard for athletes to actually seek help and recognize that they need help? And maybe I'm going to pass it on to Jessica to get started with that.
For sure. Ooh, echo, sorry. Myself, I was an athlete as well. I played college and soccer, and I had an injury that ended my career. And I think it was just really hard to think about how to normalize the experience after an injury, how to normalize kind of mental health in general. I felt a lot of shame myself, trying to think about this injury and why I couldn't get back on the field or why I couldn't get back quick enough. And so that's what really led me into pursuing this kind of work. And I see this time and time again. I think our athletes also have a lot of unique kind of factors in their lives. And so I often think about it as risk factors and protective factors that sport really provides. And so I think a lot of times it's hard to understand that. I know that recently I had an athlete come to me and was talking about some relationship strains due to training. And the therapist actually told them to just quit, and so I think it's just understanding like athletes and their goals and their dreams. And it often is a pretty nuanced population. And understanding how sport really fits in their life and as a part of their identity. So there's a number of things that I think really influence athletes not feeling like they can ask for help. And I'd also like to say, I think that's changing a little bit.
Yeah, I think you're right that it's definitely changing. And the more we talk about it, the more it changes. And I heard you talk about shame, but I think maybe not knowing which provider to go to. We're going to dive into all of this topic, but I was curious, Shannon, if you want to jump in and add to that, specifically from your personal experience.
Yeah, I think that it's a cultural thing. I mean, across the US, there's always been this culture of mental health being a negative thing, that you're crazy, and that once you show this side of you, this piece of you that's fragile or that's weak, that it will always be weak. And so with mental health, it's not something that we've had this idea that recovery is possible. And so in something like elite sports, where you are, going for best in your domain, best in the world, it's really hard to show any type of vulnerability. And so from our perspective, with Speedy, there were times where he could keep it together, and then there were times where he just couldn't. And thankfully, he was able to take time. The ski team did give him time away from sport, especially after Olympic Games. He could take a year off and then work his way back up through the levels of getting back to the A team. but it's different. It was different than having a physical injury. And there was so much shame and so much stigma surrounding it. There was a lot of people who knew about his struggles, and he had several suicide attempts. After those attempts, there wasn't the same type of support there would be for rehabbing, an injury. Instead, there was a silence about it. It was yes, this happened, and I will support you, but please don't share this with anybody else. Please don't let this get back into the headquarters. We don't need people to know about that. And so I think that things are starting to change, but I also think that they're changing with the athletes, and the expectation is happening with the athletes, and the policies and the procedures and the coaching and support staff haven't had the training. They haven't had the ability to change the climate. And so we're kind of in the middle of this pendulum where the athletes are way ahead of where the industry is at. And so we've got a lot to do to rapidly catch up.
Absolutely. What a testimony. And you mentioned at the beginning crazy, and I wanted to pass it on to Eric to actually talk about your personal experience and what it has led to.
Yeah, original name of the organization, we still use it. Kind of, you look at almost like a Nike versus just do it, having both. Ours was we're all a little crazy in quotes, A upside down, almost to regain the name crazy back, because it's a term that we've used, unfortunately, as a way to put people into a corner. That person's crazy. But we also use it in a way in everyday language. Shannon, your glasses look crazy good on you, right? Like we use it as a way to embellish. And I think when you use that way and you could reclaim the word, and you can talk about it in the collective, that there is no such thing as normal because we all live across a continuum, it takes away this idea of mental health being thought of in a binary type of way. You're either sick or you're healthy. You're one or the other. And I think that, we perpetuate the term stigma in this space so much because it's a buzz term. But I think there's stigma because we continue to point at it and say, look at the stigma, stop the stigma. If instead we shared our stories and we were open and honest and talked about what we've all been through, we would see that each of us have our own path where we've struggled at certain points. And I think to your specific question, I know I'm veering a little bit back to what the original was and trying not to be repetitive with what Jess and Shannon shared, is that yes, there's aspects of it that come from culture and a fear of openness and sharing. I think the other aspect of it is what we as athletes have come to know our entire lives, which is put your nose to the ground and push through it. And I can think too, while we have athletic trainers, every one of us on this call, I'm sure, has turned an ankle or a knee, put tape around it or put a brace on it and been like, I'm not telling anyone, I'm just going to get through it. I'm going to make it work because I don't want anyone to know that I'm injured or whatever it is. And then it gets to a certain point where it's injured enough and we have to go. We have to get the ice. We have to get the stim. We have to get it taken care of. With mental health, what we experience, the early signs of it, cognitive fog, malaise, fatigue, inability to concentrate and focus, these are things we can try to push through. Why? Because we put our nose to the ground and we just grab more rebounds, or we, play harder defense. And these aren't necessarily the skill aspects of the things that we have to do to fully concentrate. So we push it to the side and say, I can get through this. This isn't that big of a deal. And so now hopefully bring fully back to your question, Miriam, is I think working in professional sports, I was so myopically focused on the love that I had for working in that industry that I didn't notice all this buildup of the shit that had been going on in my life related to my personal life, with my brother being sick for so many years, my friends passing away, that my greatest strength also became my greatest enemy. Being able to myopically focus and do that much of a job that I loved ended up coming back, and I ended up crashing from the weight of all that had built up inside me.
I love that you talked about binary. I think those sports word and culturally just teaches athlete you're either this or that. In general, right. You're happy or sad. It's really put in simple ways. And I think athletes are now waking up to the fact that they have very complex emotions that now can be conflicting at any point in time. And they're starting to catch up with that. Cami, can you give us your perspective from the athlete perspective and being in a team sport? why would
Absolutely.
athletes not seek help?
Yeah, and I think, I don't believe that it's just one reason why, which is why hearing the collective voice on this call is so powerful. But the perspective that I will take on why we don't seek help is that it's a crack in the armor. It is by sharing with a teammate, you're exposing a weakness or a pain point that can be acted upon to take your position or your role on the team. It's a reason for a coach to cut you from reaching your dream that you've been working so hard to get. It's a reason to see yourself as not stable enough to have the ball in your hand in the last 1 minute of the game, being down by 1. It is a reason to lose your position on your team, either by a teammate beating you out, or a coach not feeling that you're fit enough. And the desire, the willingness, the commitment to make a team, to make an Olympic team, to get the playing time, to be seen as a leader. I feel that that's constantly protected by athletes to get to where they want to go. And you're not stopping at any cost. And I think to lift up any sort of mental health challenges, you're exposing maybe some areas that are not feeling as strong or stable or solid.
Yeah, and Kelsey, I want to turn to you for a minute and ask you, hearing all of these and what we know about not seeking help, what's the position of coaches and how can they help athletes seek help? How can they support them in that process? Because it's really it's often the fear of losing playing time, your position, and the power that the coach holds on your team and your sports career. So how can we turn that around?
Yeah, it's actually really interesting because I have had a couple coaches, both high school and college in the area, reach out recently to come talk to staff about this particular topic, which I think is really great because, they're obviously paying attention and knowing that it's an important thing to address mental health. And really, mental health should be discussed right from the beginning. With team meetings, staff meetings, not when it's too late or there's an issue, but addressing it from the start really shows that, hey, we care about you as a person, as a human. You're more than an athlete, which a lot of times, my athletes that come to me are saying that, my coach only sees me as this right wing or only sees me as, this point guard. And, they don't feel very human. And really at the crux of it, we are human. Athletes a lot of times are looked at in different ways because they're athletes, but we all have emotions and stress and all of that. So when the coach addresses it from the beginning and says, hey, I want this to be an open atmosphere. I know these things exist. If you're having an issue, talk to one of us. We have resources, and knowing what those resources are, right? Coaches should be making connections with student counseling centers. They should be making connections with therapists in the area, community resources so that they can have those ready for athletes when they do come to them. So, I think that's probably the biggest thing is addressing it from the start and, not being in denial that, the mental game and the physical game are one. They all work together. Your mind and body connection is a very real thing. So you can't just avoid and ignore. And I think, a lot of times the factors that contribute to mental health issues in sport don't really relate to sport. They could be family issues, right? There could be some big event trauma, especially in colleges. We see that a lot with different sexual assault and things that are happening on campus and off campus. So, life things happen. And I think coaches just need to be aware of that life is going on outside of sport as well.
And you bring such a good point because as a coach, you're wearing a lot of hats. You've got a lot on your plate. You are overworked, you do many hours, you're busy on the weekends. And it would be much better to, if you're not in a college who already has the resources available to you, to actually be prepared and have references and resources and names that you can yourself refer to for your personal mental health, but also have some people that you can direct your athletes to. Jessica, I wanted to ask you what kind of red flags do you guys look for, or is there a protocol in place, and are we looking at specific red flags to try to identify some challenges area for athletes?
Yeah, I think one of our strategies recently is to start, getting out a lot of education and educating athletes, educating coaches, staff around what some of the red flags could be. And the areas that we're really targeting are anxiety, depression, eating disorders, sleep, alcohol, and drugs. And that's been really helpful to get some baseline information on that. We also are using a tool from the International Olympic Committee called the SHMAT, or the Sport Mental Health Assessment Tool. And we've actually incorporated that into all of our physical health kind of pre-performance evaluations. And so not only did we do that for more than 1,200 athletes heading into Tokyo, we'll be doing that for Beijing. And we are working with some of the NGBs to incorporate mental health screenings into their physical health histories that they're taking. And so that's been incredible to just kind of get baseline information and understand, like, how do we ask these questions? How do we build the trust for the athletes to be honest with us? How do we follow up as quickly as we say we're going to? We're asking about suicidality, and have had a number of athletes identify that they've been feeling suicidal and get to them immediately and have a response immediately. And so those have been kind of some of our strategies to better understand what's going on. And then I think even just more specifically, like, we are incorporating mental health screens into our concussion protocols, like anywhere that we can ask these questions. We're trying to, if we have a camp come into the training center, we now ask a mental health question, have the same questionnaire. And then any new athletes that enter the system. So they're going to start getting those same questions about anxiety, depression, eating disorders, drugs and alcohol, and sleep. So we're getting really good baseline information, and then just trying to be very responsive to what athletes identify as mental health concerns.
Really interesting to hear you guys putting in place lots of resources around the baseline and pre-training, and as part of the assessment of the athletes in general. I really love that. Shannon, do you have anything to add in terms of red flags or things we should be looking for, especially for coaches, not necessarily at the highest level, but people that are exposed to athletes on a regular basis? What should they be looking for?
Sure. Yeah, I think that where we start is always with suicide, because if we're thinking about worst case scenario, we're talking about suicide. When we're looking at active shooters, the signs of suicidality are typically present when we are attuned and can recognize that. And so for coaches and for staff that are just starting this process, starting with a gatekeeper training that teaches us to recognize the warning signs and the risk factors of somebody who might be at risk of suicide is a great starting point. And then to dive in even further and to bring in the pieces where, if eating disorders or early childhood traumas are involved in that community, then that would be the piece to bring in. If you can start with suicide and really think about sudden changes, when there's sudden changes to sleeping and to eating, and to, self-talk or expressing thoughts of suicide. Those are some of those big ones, but there are a lot. And really anything that impacts a person's ability to live, laugh, love, and learn is something that needs an intervention. And that intervention typically can be as simple as a conversation. And so if we can saturate coaches and staff and parents and athletes themselves in being ready to recognize something isn't going right, we need to have a conversation. I can start it out by saying, hey, I've noticed X, Y, Z. I'm concerned about you. What's going on? And if they are concerned about suicide, then talking about that directly and knowing how to refer that out, that we're not teaching anybody to be counselors. We're just teaching them to be compassionate listeners, to have conversations, and then to share that out with someone else. It might be calling the suicide prevention hotline, which everyone should have in their phone number. That phone number is 1-800-273-8255. Something to keep in your phone. You don't have to be suicidal to call. If you're concerned about someone and you've got this gut feeling, you've got these red flags that are out there, we also call those invitations. Somebody is struggling and they're giving you those invitations. Call the hotline and say, I'm really concerned about my friend. This is what I'm seeing. What can I do? They'll help you come up with a plan on how to address that. But from my perspective, when I'm out there, the risk factors that these individual athletes are exposed to and the traumas that they're exposed to really seem to be the things that coaches and support staff are the most concerned about.
What I'm hearing from all of you is really this a global approach to mental health, having protocol in place, making sure everybody is educated and trained, making sure that you are available to notice what's happening, to be aware, to have enough awareness that you can take action and have a simple conversation. The other side is also who, more from a formal perspective, who should athlete turn to for help? And maybe Kelsey, that's something you can respond to, and Eric from two different perspectives.
Yeah, so, I think that's why there's an importance in knowing the differences of providers, right? So a lot of people end up getting psychologists and psychiatrists kind of mixed up. Psychiatrist is medical, more medical doctor prescribing medication. Some do therapy. Psychologist, usually you're going to for clinical counseling or testing. And then we have our master's level clinicians like LPCs or LCPCs, and, all the letters get confusing, but, there are good websites like psychologytoday.com. They have a research tool where you can put in your zip code and then also your insurance and be able to look for people who are in your area, but also specialize in different areas. And I also know that, even just doing a Google search of like sport psychologist in the area, you have to be careful of really what you're getting because of the credentialing. But I think it's important, just even for counseling services on campuses or social workers in schools, they do know resources and they have resources. So if you're confused about who to go to, just asking somebody about pointing you in the right direction is important and a good first step, because a lot of times that's what keeps athletes kind of silent as well. I don't know who to really approach, and I don't know what this person's going to think about it, so I'm just not going to do much with it.
Yeah, and I hear you. Sorry, Eric.
No.
Please go ahead.
Yeah, just because you'd mentioned both names, if there's a transition point, let me know. Coming from an NBA league office background and then seeing the changes that were made where there was a requirement for mental health professionals to be hired by NBA teams. The NFL did that as well. I think that's a good step. I think there's a challenge in that step, which is I encourage everyone to read the Ben Gordon Players Tribune article that came out about 2 years ago. And he describes, this was before the era of the requirement. And he said, and I hope I'm not disrespecting anyone, I'm using his language. He said, what is some middle-aged white woman with glasses going to tell me about my life that I don't already know? Right. And so I think there's this perception from athletes that I go to this professional and I go to this professional to get my brain shrunk, to be given a label. And I'm going to stay away from going to that person because I don't want my brain shrunk and I don't want to have a label. And so I think a big piece of normalizing this conversation, to your main point of the question of who do we go to ask for help? We do an audit when we meet with, whether it's professional sports teams, whether it's Division I sports teams. Your different coaches are going to have different levels of willingness towards vulnerability. And so it might not be your head coach, and you have to be okay with that as an organization that that's the case. But it might be, let's use a football team as an example. It might be your assistant coach who, when I talk about vulnerability, I don't mean that person has to come out and say, I've been struggling with bipolar my whole life. I mean, that person needs to say, I've been going through a pretty difficult divorce and I'm having to balance the struggle between that and what it means to give my all 24/7 for this football team. So I know the rest of you are challenged with that, with your schoolwork between what you're doing on the field. That creates a safe space for the athletes to then be able to come in and share, right? From there, then creating consistent language. And so I know we've, and I hope I don't get branded as like the anti-DSM-5 guy, but I'll just share it out there. A lot of times, because the words are depression, anxiety, suicide, bipolar, etc., there's a hesitancy for athletes to open up. So we created a scale, and the scale, back to what you were honing in on, Miriam, about not wanting this to be a binary topic. The scale goes thriving, gliding, surviving, fluctuating, struggling, sinking. And that way, when the athletes are looking at that, and there's emoji faces that are related to each one of them, what we share is being anywhere on that scale. If I'm a coach and I'm going through a divorce, if I'm to the right of that scale because I'm struggling right now, that doesn't make me weak or a bad person. It makes me human. And then you explain underneath the scale, when you're to the left, you have this psychological flexibility between parasympathetic and sympathetic response. I think we think that athletes won't listen, but when we share with athletes the X's and O's behind, why did I learn to do plyometric box jumping? Well, they could say because my vertical leap got better. That's not enough for me to do plyometric box jumping. I want to know that my fast twitch muscle fibers get torn. They get built back in a stronger way that allows me to push more deeply into the ground and lift more weight off the ground and get a higher vertical leap. I think the same thing is the case when it comes to our brain, when we can give at least a little bit of the science and the background behind why we're using these terms, how they fluctuate up and down, and then based on that, how they have the ability to exercise their brain like they do their body and work towards better places on that scale. It allows them to take control and then feel more comfortable opening up.
I love this idea of removing some of those words that really athletes do not want to hear, they don't want to talk about, they're trying to avoid at all costs. I think that's really encouraging. And also, this is a journey. So like if you use the image of a scale, it moves. And so you are moving through all of these, where I think with the labels, it feels like it's a little bit more sticky to you and a little bit more long-term, I think. Cami, what's your perspective from the athlete side? Who would you turn to ask for help, if at all?
Yeah, and I first and foremost want to lift up the fact that we're talking about even protocols, labels, scales, all of these things, because I'm thinking about my experience as I reflect as a college student that we didn't have a mental health profession on staff. What we had available to us were the university therapists, psychologists. That was our outlet at the time. And I'm not a million years old. I am older, but just how much growth has happened. And to have these types of mental health protocols and kind of testing and questions that are being asked to athletes in place, to me, I immediately go to, we're training athletes to be aware of this, and that it's like, it can be normal, it exists, it's there. And we're training athletes themselves to be aware that this is a potential. And that hasn't been a conversation, that hasn't been a discussion for a very long time. And we're getting to the point now where we're actually training athletes to be able to identify it in themselves. And have a space to do that. I really connected to Jessica's comment about, I had just went to the 2008 Olympics. I came back to college. I was having a super hard time transitioning back into school after taking a year off to train and compete for the Beijing Olympics, and not having the outcome that I wanted. And went to a psychologist there on campus that wasn't, connected to athletics at all. And the same thing, I'm like, this is what's happening. This is what happened. This is what's happening. And she goes, this is horrible. You should just quit. And I was like, so defeated. Like literally, I was like, you absolutely don't get it. And I went on to winning a national championship and 2 gold medals at the Olympics after that and everything in between. And it was like, imagine if I would have taken her advice of, getting through the storming part and the challenges of where I was at, and allowing it to stop me there versus build me to where I got to. And so I think having availability of resources and where actually you can go that feels like it will connect, to Eric's point, and you can be heard and seen in what you're really in is super important. I also think there's a balance of having a mental health profession working with the team, in the team, talking to the coach, like there might be some closeness there. And I think that it's important also to have resources outside of the team that's not connected, but also get the mindset and the lifestyle of an athlete. So just having just a lot of different options. But again, I think what I'm most proud of and want to lift up in this conversation is we're training athletes to be aware of potentially what's to come and inviting it and saying we actually were aware of it. We see it. It's okay. And we have the resources for it. You're not backed into a corner with that, which is not something I had ever experienced in my athletic career and could have definitely, used it.
Thank you, Cami, for your contribution. And it's funny, as you were talking about this, I can relate still today. I hear from some athletes, even close to me, who are saying, I needed to see a therapist pretty quickly at my school, but that person needs to see 800 athletes and I'm the only person, and that person had 5 minutes for me. So I think we're starting to see athletes willing to engage more with the staff, but the resources not being there quite yet. And so I think that's interesting to see kind of this discrepancy a little bit. One question that still comes to mind is, how do we get coaches and therapists and mental health professionals to kind of work more together, yet still keep that distance and that confidentiality that is necessary to support athletes? Because the reality is, whatever the coach say is what the athlete is going to follow, whether it's nutrition, whether it's lifting, whether it's mental health. And so we really need to have a common language and make sure everybody's on the same page. And so I'm just curious, as a final question to all of you, how do we navigate that balance? And I wonder, Jessica, if that's something that you guys discuss on a regular basis.
Yeah, I can say something quickly. I just met with some of our top USA track and field coaches, and I think there just is still so much stigma. And so distilling and normalizing, I think one of the things I've told them is that they can be the professional's eyes and ears, that they're able to notice something that might look different, feel different about an athlete, and they will know that athlete's norm long before I will, sitting in an office. And so just empowering the coaches to know that they have a role that they can play is really, really important. And so I think just empowering them and saying, you can be a part of this solution, and just empowering them has been one of our strategies, and then giving the education to where they feel comfortable to actually speak about mental health.
I think also empowering coaches to look at this through the lens of performance. I think, to your point, Miriam, about the separation between brain and body, and thinking of it as there's a mental health and there's a physical health. Why do we see something, I'm dating myself here, but like a Chuck Knobloch with the Yankees was at second base and couldn't throw the ball to first base, right? Like he's completely not able to hit a target. And then go to more recently, like Simone Biles and her inability from a spatial orientation perspective to be able to land the jumps that she landed or the vaults that she took. And I think with coaches, it's, if you have mental health, it's in this separate category and it fits alone. And they don't see it in the construct of, let me see the little pieces of performance where someone's missing a free throw by a little bit. It's not as major as what we saw with Simone Biles. It's not as major as what we saw with Chuck Knobloch. But when we start to look through the lens, because the unfortunate reality of it is, working with these coaches, a lot of them are motivated specifically by the wins and losses. And when the wins and losses start to get affected because they're able to look at athletes through the lens of the things that are impacting this are impacting the way that they play. And it doesn't have to be something as drastic as they need to bow out now because they're dealing with this thing called depression. Now they're willing to be more attuned to it because they're willing to say, if that person's making the slightest bit of an error, they're not able to locate their pitch when they're throwing a fastball, what might be in play here where the brain is involved in that brain body connection. So I think it's just using language where they relate to it a little bit more and not looking at it as this separate category that's different than overall performance that they usually judge.
Yeah, that was a great input looking at it from the performance perspective. Shannon, you want to add?
Yeah, I'd love to. With the Speedy Foundation, we've been doing some mentally covered trainings and have been working with some college athletic departments. And it's just interesting because when we start out and say, you know, were you a college athlete yourself? Yes, almost everyone in the room was a college athlete themselves. And it would be, you know, well, what does mental health mean? What did it mean when you were a player? And it was nothing. It was either it wasn't a thing or it was a negative. And so we have to change that piece of it. But some of the restrictions that they have in place are that athletes can access, sometimes there are mental health professionals that are now embedded in the teams sometimes, and those are overworked. And so there isn't quite the bandwidth. It's just beginning to build that culture of trust where athletes are going to them and opening and expressing and receiving treatment or being referred out. But then some are accessing campus mental health services, and there's HIPAA that's in place. And so some athletes that are in crisis and are traveling are actually being treated, and there is a breakdown in communication. There's also policies and procedures that are in place where coaches are not allowed. They can notice, they can recognize that something is going on, and they are not allowed to talk to the athletes about their mental health. And then it gets into issues with, athletes that are requesting time off and scholarshiping. And there are so many pieces because we don't redshirt for mental health. We can't see mental health through an X-ray or through an MRI. And we've just got a long way to go in a very short period of time because we have this surge of younger athletes who it's just not, it's a non-negotiable. This younger generation expects that their mental health is going to be on par with their physical health. And I think everything that we do in this preventative piece to educate, to advocate, and to have these conversations, to share stories really does help us increase that level of mental health performance, to go off of what Eric mentioned.
Fantastic, Shannon, and that was so true. And I've noticed exactly what you talked about, you know, the fact that you can't redshirt for mental health issue, that you're struggling with the loss of your scholarship, all of these challenges that are associated with it, and we don't know what to do yet. Kelsey, Cami, do any of you want to add anything?
All of the above. I mean, yes, I think you all made such great points. I'd also like to add that there's an important piece that we found through some of this research, that the athletic trainers are actually the people that athletes are talking to the most about their emotional well-being and things that go on in their lives. I think that the head coach most of the time is not the person they're going to, and probably the one person they actually don't feel safest in going to because that person makes so many big decisions for them. Just knowing that the athletic trainer is that person, if you're an athletic trainer, you probably want to get a little bit of training on how to speak about mental health and refer people out and how to do that.
That was a great point. Cami? Yes.
Yeah, and I would just invite, just having the resources available for teammates as well, because I think as a teammate, we're about as close as it gets to each other. And then everyone else just starts to get a degree further away from the athlete. But I think, if I think about the closeness of a team and how we travel together, room together, locker room together, we're about as close as it gets. And I think, as a teammate, I've experienced noticing, things that are off in my teammates, and just feeling, again, if you have a teammate who has the ability to advocate, who has the strength, who is in a position to be clear-minded, then, where do they go and how is it safe and what's the protocol for that and how are we designing that? But even our responsibilities as teammates to show up and start the conversation.
Yeah, and that's so important because you're looking for one another, and that's what you should be doing as a team. So if teammates and athletes could also be trained on how to recognize the symptoms and do their first aid, their mental health first aid, that would be super valuable as well. We run out of time. I want to thank you all for joining this discussion and your input, the resources that you've mentioned. We're definitely going to share with our participant afterwards, but once again, thank you so much and much appreciated. Continue to do all the work you're doing. Thank you, guys.
Thank you.
Thank you. Bye, everyone.
Bye-bye.